Welcome to the Medical Device Made Easy podcast. Here is Munir Al-Azouzi from easymedicaldevice.com. And today we will help you to understand how to do your post-marketing surveillance and maybe also your vigilance for your products. And I have with me Ivan Perez Chamorro from MedBoard. So I know Ivan since a long time now, and I'm really happy to have him again on the podcast. So welcome, Ivan, to the Medical Device Made Easy podcast.
Thank you, Munir. Thank you for having me. Thank you.
Yeah. So just for people that maybe know or don't know this podcast. So when I started, you were the first guest on the podcast. So you were confident enough, if I can say, to be my guinea pig and to have you first on the podcast. And I really want to thank you for that. So how is it going since this first episode?
Yeah, Munir, I think I was the first person to dare to join the podcast, right? I think when we talked initially, I think we both aligned how things should be, with digital and how to explore new ways to share information and data. So things have changed massively since the first time we met. And for me, it's a real pleasure to be back here with you in the podcast. I think some people have been asked when you're going to be back, and
really?
For me, it's a real pleasure. I think we had a very busy schedules, but finally we're here. So I look forward to a really nice discussion here.
Yeah. So on this first episode, we are talking about entrepreneurship. And talking about your journey, if I can say, to start MedBoard. And I remember at that time I was still not an entrepreneur myself. I was still working for a corporate job. And I remember this sentence that you've said to me during things when I asked you, when do you think it's the moment to move to entrepreneurship? And I say, you just have that on your head. You have to jump, if I can say, to make this jump. And this is the thing that I have made after listening to you. So, and I'm really happy of that. I'm really grateful for that. And I wanted just to thank you also because maybe people don't know, but you were the one that nominated me for the Top Pro Award. And so you believed on me also on that. So I really thank you for that. And we won it. So it's great. So thank you for that. So I'm now awarded of the Top Pro Award on communication, which is really great for this podcast. So thank you for that also, Ivan.
Yeah, no, I'm so happy for you. I think it was a good recognition for you. My first recognition was just jumping into your podcast and say, let me be the first one. So, I really believe this is a right format, and this is another way to communicate all this regulatory clinical information, through, a broader audience. I think like collection, it was nothing about me. It was about collection, the information from many other people that wanted to collaborate, right? And all the recognition is to the hard work you've been doing. I think like for many people, you've been an inspiration.
Right.
All the hard work delivering all these podcasts every week and with very interesting, topics. Myself, I listen to them. Sometimes I give you some feedback. I say, I learned about this, listening to you and this special guest. So I think it's very something that is changing the way people are communicating. And one thing that you need to be proud is after you started, many people started to do as well, like all the podcast.
Yeah,
so
that's great.
It's a good indication.
Yeah, I also followed some other podcast guru, if I can say, because there was John Spear from Greenlight Guru that I was also following. So, I mean, it's a great thing. So I hope really this will be helping a lot of people, and I'm happy that it's helping already. So today we will be trying to educate people again on some topics, if I can say, that we've selected. And the main topics that we wanted to talk about is post-marketing surveillance, vigilance, all those activities. And I asked you to come because you are offering some services that can be interesting on that way. But before to talk about that, so can you maybe make a reminder to people of what is post-marketing surveillance, what is vigilance, what are all those things that we are talking about here?
Yeah, sure, Munir. I think the definitions vary depending on the jurisdiction, also depending on the countries. In a high level, what authorities are asking, or it's not only about authorities, just like business needs, just to know that you're going into the right direction. is to collect as much information as you can about your product, about similar products, analyze that, and then take action, following that information. So as is defined most of the times PMS, and now with this PMCF, is more a proactive activities. Vigilance is more reactive activities, right? So just looking into adverse events, looking into complaints, looking into recalls and different actions, right? So it's very depending on the country, depending on the jurisdiction, the definition may be different, but the high level is collect information from your device, from similar devices, analyze it and take action following that.
No, I think it's great. And as we have now a focus on EU MDR, we are thinking of that. So mainly there is a lot of things related to post-marketing surveillance, to vigilance, etc. Just wanted that you maybe confirm that, but PMS or vigilance is not something new coming because of EU MDR. So it was already existing before.
Yes, I mean, all this PMS, vigilance, even like trending reporting, it's always been with us. But the reason is why it was not that popular, probably is because it was not that enforced by authorities, right? So it was more like a nice to have, even if it was not a nice to have. So now the requirements from authorities, from notified bodies, from any stakeholder are asking manufacturers to be more proactive with those activities. And traditionally, most of the companies, they were just reviewing the complaints. Some companies, especially from our perspective, we can see how some companies doing a really, really amazing job how to collect that information, reviewing monthly or every quarter, and how other companies are only reviewing complaints. So, I think the purpose from authorities is to enforce this in a more proactive way, so companies can be on top of what's going on with their products.
Yeah, and as you mentioning, companies do it on that way or this way, if I can say so. It's something that depends on them or their procedures, but can we have kind of a standard way to do that? So how can we do a post-marketing surveillance mainly for companies? So do you have kind of a step-by-step process for that?
As you said, this mainly depends on the company. The normal or accepted, structure is always like following your PMS plan. So in your PMS plan, what you do is you specify all the activities, the frequency of those activities, the collection of those activities, the sources you're looking into those activities, and also the review points, right? And what you are going to analyze. So when we're talking about PMS plan, you can look into only clinical information, but you may look into regulatory news information. You can look into standards information. You can look into patents, R&D information, because all of that may impact in your products. So the PMS plan is, in a very holistic way, is a way to capture all the information that can affect your product. And it can affect as well the benefit risk analysis of the product. So, companies, because this is based on legacy information, most of the time they were just looking into different sources, analyzing few sources, getting feedback from their internal sources through sales and so on, and updating. Other companies, they were doing a great job. So I think like one of the key things with all these new requirements is a way to standardize all these practices. So, from an external point of view, you can assure that company is doing the maximum, they can to capture all the information. One of the key things as well is, and this is a massive change, from even 5-10 years ago, is you gather your PMS or vigilance information either from your internal sources, right? So you work in companies, so you go through your salespeople, your R&D people, engineers, just be in operation room and so on. But you also gather that information from external sources that are out of your control. So this means like literature, this means like feedback, about your product in a social media or in a blog or something else. So something that has happened over the last 5 years is because the information technology, expansion, now is easier for many people and organizations to share information. So what traditionally companies, they had a really good control over the information only using internal sources. Now the external sources can provide as well a very key information about your product, and not only about your product as well as about equivalent or comparable devices, as like some standards.
You can have a tweet that can come and say your product has a complaint or whatever. You can see what's happening with your competitors. There is a lot of articles that are also happening in some journals for medical devices where I'll say, oh, this competitor has this warning letter, this issue, this complaint, this adverse events, etc. So it's not, as you mentioned, it's not something that is just kept within a company now. It's really sent to many media, social media, or some things that maybe then can be also used by other companies.
It's much more difficult, you think, from a manufacturer perspective, because if something happened in the past, the only thing they will think, I need to report this to, the authority, the medical doctor. Now, probably like some people, the first thing they will think is to do a tweet, right? Yeah. Or to complain, to put it online, or to share with someone in a chat, or so, things are changing very rapidly. So how to capture that information is becoming very, very key.
Yeah, and this reminds me something. It's about, for example, when you have some products that people, if I can say, start to complain about, they are starting to create, for example, some Facebook groups for gathering those people that have to talk about this product and to say how bad it is or how good it is or whatever. But there is more and more those things where users, consumers are gathering to talk about a product and maybe to say good things or bad things. So if companies don't know about that, they cannot really understand what they are doing good or what they are doing bad. And the information that is provided there can be also used as their inputs to say, oh, this is what people think about our product, etc. So this can be something that we can improve. So I mean, on the old way, if I can say, we were just looking at official sources of information. Now there is all the rest, which is non-official, if I can say, but it's more people talking about a product, and we have also to manage or monitor what is said about it there.
Yes, there is something like very interesting, right? If we look at what is PMS and vigilance, and what is intelligence, and what is research, essentially is the same thing with a slightly different scope, right? So what you're saying is very important. This is not only to comply with regulations; it's also to be on top of the business, or to know what's going to happen next, right? If we look, what is PMS and vigilance probably is very oriented the scope to a product level. If you look at, to know what you should be knowing, right? If you look what is intelligence, is the same, but more as a company level, right? So what I should be knowing. And if you look at the research, anytime you want to go explore new domains, right, is using the same sources to learn about new keywords. It's about learning new topics that you should be, learning, for the next phase. So eventually what authorities are asking is kind of like a business, like 360, like to understand, you need to understand and show me how you understand everything that is going on with your product.
I think it's clear here. So we said mainly on the step-by-step process that we are gathering the information, we are analyzing that, and we are taking actions, if I can say, about those information to say we should do nothing, maybe because our product is good, or we should maybe update that because maybe something on the instruction for use is not clear, so we have to update it, etc. This can also open the door to maybe do some clinical investigation, because maybe there is some needs for this kind of application which is not in our product, etc. So it can go to many directions out of that. So with the new medical device regulation, we have to create a PSUR, so periodic safety update report. And there is, if I can say, some proactive action also that you have to do. So it's not like just gathering information, it's also how you are going to the field to initiate some research or initiate some studies. So do you think this is going on the right direction with the MDR now?
I think, you know, what the MDR is doing is putting more explicit what companies should be doing. I think if companies keep it like simple, right? You were talking about the steps. The steps are always, you know, basically the same. You need to select the sources where you're looking for that information, right? Are you looking for adverse events databases? Are you looking for clinical journals? Are you looking for field safety corrective actions? Are you looking for hospital news? That's the first step. It's very clear, right? And you need to select which sources you're gathering that information through. Like you can use the external sources or your internal sources, you know, within your company. Where do I get that information? And all of this has to be active, you know, systematically. So you have a system that works and has to be continuous, right? So that's the first step. The second is the collection, which is not only like putting everything together, is having all that data in a very structured way, so you can move to the next step. Which the next step is to analyze and review. So obviously you need some knowledge to understand your consequences of that. You need to have some perspective of the product and knowledge about the regulation and the technical requirements. And the fourth step that you were referring to is either you can take action, right? So you need an immediate action, regulatory action. You need to update your IFU. You need to do a design change. You need, you know, something to do with your product. Or the other action could be that you need to update reports, right? So you have all these reports and you need to update periodically. Or that can be an input as well for your intelligence or for your research, for example. So the step 4 has different defined, you know, outputs depending on the company. So the action, we see these 4 steps, right? In the first and the second is very standardized for all the companies. The third, what to analyze, what to review, what are the thresholds that company uses. And the fourth, what actions taken based on that criteria is what it changes. It's what is more interpretative in the companies. But that has to be defined in, you know, by each company.
Yeah, it's really, as you mentioned, first we have the plan, so we have to say how to do it, and then we do it. But every company can define the way they want to do that, because I think a software company is not doing the same as a wheelchair company or as a pacemaker company. So everyone has its own thing. So one thing that is also important is that you will gather a lot of information, but sometimes too much information is too much, if I can say so. How are we analyzing that? So it's if we have not a lot of information, we can or being not accurate enough, or maybe it's enough, I don't know. But when you have too much, the issue is how you analyze all this, how you get all that, how you make a sorting. Because, for example, when we are talking about clinical evaluation report, we have a kind of appraisal method where we are gathering all the literatures and then we make, okay, this is a good one, this is a bad one, this is this and that. So do we have the same for PMS? Do we have some kind of filtering to do on this?
I think in the case of the PMS, right, and you know, we need to remember as well, the PMS is mainly focused on the residual risk of that product. So it's to monitor the residual risk of that product. I think what is important for, you know, especially for the collection step, is to know the keywords and what is important for your company, right? So this is the important thing, like when you have your PMS plan, and you should know what type of information you're looking for. You have already a structure for your collection and also for your review. So one of the effective ways is to define which keywords are relevant for your company, which keywords are relevant for your product or your product lines, and combine them or separate them depending on what is the case. But the most effective way is to understand how the sources called your products, or how the sources called your type of products, and have an inventory of all those keywords. because those keywords are going to drive most of your review analysis, as clinical literature has been doing for many years.
Yeah, and so in the old way, if I can say, you had maybe to look at each journal one by one, or each information one by one, or each complaint one by one. Now I think with the softwares, it's easier to gather, or maybe with databases, it's easier also to gather more and more information. Do you see this difference between paper-based and software-based collection?
Yes, I mean, one of the key things that is happening with the MDR is not only these more explicit requirements, is also the explosion of information that is available out there, and the impact assessment that probably hasn't been, completely assessed, by my authorities when they're asking, to manufacturers to do all of this, right? So they're asking manufacturers to do many more things with much more information out there, right? So this is a real challenge, and that's why the opportunity to use software, to use algorithms, to use some certain level of artificial intelligence is what is very important, not only for making companies more accurate, but also to make them faster. Which, if we talk about resources and if we talk about budget, that's very important for them.
Yeah, and I'm asking mainly this question because when I learned about MedBoard, first it was for me just a tool that is gathering information in terms of regulation, changes that, all the text, and helping people to understand better the regulation. I was using that myself for the MDR to look specifically at each article, what are the kind of synopses that you are creating, which is great. Now we can use MedBoard also for our post-marketing surveillance search. So it's a new tool, I think. So how is it working?
It's a new tool. It's the same vision, right? Okay. So when we talked 2 years ago, right, it was about integrating all the information. We keep having the same obsession, and our obsession is how we can make information and data instantly available to companies, instantly available to different stakeholders, right? This is our main focus. The reason we started with regulatory information is because probably it's the most complex problem that we can solve right now, right? So we said, we based all the platform in the first principles, right? So if we can define, the specific information and what's the problem, and then we can scale from that, we could solve a lot of problems with, accessing information and data. So you are right. We started with the regulations. We broke down all the regulations by paragraphs, by different sentences, right, to make things more accessible. Then we expanded from regulatory to clinical to market information. Now we have standards, and we have as well R&D information. So our main focus is the same. And this platform, because it makes information instantly accessible, and also, with the view that it can be customized, so anyone can customize this with the keywords that they like. This is a very powerful tool for the PMS and vigilance, especially for the external sources. We're talking about subject devices or talking about comparable equivalent devices.
So as we said, so for example, we have to make a research on certain devices, equivalent devices, etc. So how many sources of databases, or how many? So when I gave this keyword for this kind of information. So how MedBoard is working? So I suppose you go to a lot of databases to get all those information. So how many databases are we talking about here?
We're talking about thousands and thousands of databases.
Okay.
We're talking about more than 100,000 sources. Okay. We're talking about millions and millions of entries. One of the important things for us is not to have that information, but also to organize that information for you and structure that information. So when you come and do the search or do the analysis, it's very simple. You just need to go there, your category, and search it. For us, the real challenge has been, as we discussed before, is to structure from the very bottom of the structure and building the blocks. I think when we get this feedback from companies and from individuals that say we change their lives, because normally they were spending days or weeks doing that, and now they use few seconds. For us is the best feedback we can get. So I feel like through science and engineering, we can build that magic, that to have that information in real time for companies. I think that's what our goal is.
Yeah, I mean, I can imagine, because myself, I have done some post-marketing surveillance reports, and as you said, we have a list of sources to go through. So I go to the first one, it takes me 1 hour to gather those information. I go to a second one, it takes me another hour, and maybe there is some bugs, so I have to go to the third one and come back to the second one later when I will understand why those bugs are happening. And then I go to the fourth one. So each time it was like 1 month, if I can say, of working to try to get the source, to try to organize that, to think about how it is done. Is it correct or not? Oh, last year we had more issues. This year we have less. Should we redo the exercise a second time because maybe we missed some of them, etc., etc. So it was really a nightmare. So it's why a lot of companies were doing that once a year, because it was the time where I say, okay, let's spend one time a year, invest 1 time a year for that. But here, when I hear what I'm hearing now, so mainly it's like you set up all the keywords and everything, and you just click a button and you have all the information already available in a click. So I mean,
not only that, Bonir, every time there is an update and it matches your query, is there. So basically, you don't need to do anything again.
So it means that instead of waiting every year to do it once, you can do that every time in a continuous basis then.
Yeah, you can go any day, anytime, and export it, collect it, and that's it. So you don't need to go through that. We had so many cases. I've said, I have to go to all those websites. Some of the websites, they don't allow it even to search. Some websites, they don't even give me the old information. We complement information because sometimes they don't give you everything. And one important thing as well is we provide as well like search operators. We provide as well advanced search operators. So you can do a very complex query. And instead of doing one search, you can do a complex query that combines maybe like 20 queries, and you have all together. So, essentially it's even saving more time. So I think like the real challenge, and, coming back to your question before, is not knowing what is happening inside of your company, right? Through your channels, is knowing what is happening out there. And because it takes so much resources, most of the times, as you describe, instead of doing like every quarter or every month, they say, okay, let's do it annually because this information is just difficult to get.
No, I think it's great. And I hope this will help also to catch information and catch issues as early as possible so that they can make some modification already now. Because as I said, if we do that every year, so you wait 1 year to maybe catch all the issues, and then I'm sure they are doing some kind of iterative work in the middle. But if we are trying to get all the view of your products, then you'll have to wait for 1 year for that. So I think it can be also a good exercise then to work on that. So MedBoard, as I said, it's starting now to gather more and more information. I mean, for me, really, MedBoard is really revolutionizing the medtech industry, because, as I've said at the beginning, before you had to read, for example, the MDR within a website or within a PDF file. Now you go to MedBoard and you have all the things sliced up, and then you can just take a piece of it or find information. Each time there is a new change in the regulation, you also get that on MedBoard, because I'm using that also for an update. So I see the updates that are available there. Now PMS, as you mentioned, now a lot of things that are coming. So I imagine for myself, if I am now a medical device manufacturer, with MedBoard, I can do so much. So what is the limit here? Where are we going with all that?
That's a really good question. I think, what we try to do, Monir, is, we had this vision to, and I explained to you, like, to make all the information instantly accessible. And when we had all the information, data, the scope can just be, from many sources. But what we're doing, and you can see we don't do a lot of marketing, it's like we're focusing on improving our product to the companies that come to us, that they want to collaborate with us and they love our product. And by little to have a better product. This is our main focus. And, one of the key things is our product is driven by customer needs. So, what we see today is not, myself, the team with the scientists and engineers thinking, okay, what should we do next? Is, most of the times it's driven by a person or a company saying, hey, can you add this information? Because this would be very good to have. Can we add this specific information about PMS? Can I gather this information this way? So we are very close to the customers, and this is the way we want to continue. The scope of the limits, we don't know. We build this platform. It's a big data, information data platform. We have so many ideas. We have many projects that are going to be released during this year as well. I think the limit it depends on the customers. If the customers, they want more, as it looks, as we have now dozens and dozens of companies, this is going to keep improving and adding more and more information. I think the challenge for us, we're having in engineering, right, and a science, is how we can gather all that information and keep it structured and working efficiently for everybody.
Yeah, what I hope is that people will really call you one time the Google of medical devices, because it's how we talked about that before. It's to say MedBoard will be the Google of medical devices. Each time you search something about medical devices, you go on MedBoard and you have all the information that you want, which I hope that for you. Okay, so mainly just another question, maybe. Is this something that is really valuable for only small businesses, or even big companies are working with you on this platform?
Oh, no, we have a very wide range of customers, from very small startups to very big organizations. I mean, I'm talking like billion, like organizations. I think there is, it doesn't depend on the size, I would say. What it depends is in the mindset of the company, right? So we're discovering those with a mindset that is more proactive, with a mindset is more like technology, with a mindset that they value the time of having that positive culture in the company. Those are the ones that are embracing this platform in a much faster. Those are the early adopters. We have huge organizations, and you can imagine as well, the bigger the organization, the savings are even bigger. Because you have more product lines and more information to gather. I think for SMEs and small companies is equally a powerful tool, because they don't have the resources of the big companies and people to look for this information. And if you are a quality manager or a regulatory manager or a clinical manager or R&D or marketing manager or director, you need to look for this information while you do your normal job. It becomes, very, very difficult. So one of the key things, especially for small and SMEs companies, to say, well, I'm able to do my daily job and also like to keep an eye on that information that is collected, for me. And I know that if anything happens, I can go there and it's there, the information. No, so is one of the key things for us is to serve to those people and organizations. They believe in this digital transformation, and they believe in this proactive way of doing things. You need to think as well, like MedBoard in a way is a very proactive tool, because in opposite to be looking for, to wait for that information, we're asking companies to we have all these hundreds and hundreds of databases. You can put the keywords you like, and you can go for it, the information, before it comes to you. So it's a very powerful, proactive solution in the same way.
I think it's good. Anyway, I am recommending MedBoard to anybody that is asking to me, because there are people that ask me, do you have a platform to make your regulatory updates? And I say MedBoard. Do you have a platform for this? It's MedBoard. So mainly I am using MedBoard. So I'm really recommending that. So don't hesitate to go. Do you still have the free offer, if I can say, for people so that they can join MedBoard for a few days just to test it?
Yeah, we still do the free trial, and we believe it's the best way to especially for a product that there is nothing like us out there. So the best way is for people to, we invite them to come to join the free trial. They can review this within like a couple of weeks, 3 weeks, and then they can feel whether that's the right product for them. So we do this in a way like building more like trust, with the companies, like we can work together rather than, buy it, you just have 2 days, buy it. For us, it's more like building a relationship. As I said before, as most of the developments we have is driven by them. So it's a bi-directional, relationship for us.
No, I think it's great. So don't hesitate to go to MedBoard and to test it. They have a 2 to 3 weeks trial, so test it and check how it is doing. If you like it, so also say that to all your colleagues or anybody that is really looking for that, because I think this is really a promising feature that every company should be using. As I said, myself, I'm using that, so it's really something that I really recommend for that. Okay, Ivan, so I think it was really helpful. Anyway, anybody that wants to do their PMS search have to use MedBoard now, because they will save a lot of time, and time is money. So I think your management and your company will be happy for that. But yeah, for any other thing, so you can contact Ivan. So Ivan, we can contact you, I think, on LinkedIn. Or directly on MedBoard. But yeah, anyway, I will put your LinkedIn information so that people can contact you if there is any question specifically.
Yeah, sure. Yeah. They can contact me, through LinkedIn or through any, email address that is linked to my organization. So yeah, that's
great. Okay, so really thank you for that. So Ivan, then I wish you really a lot of success with MedBoard. I'm sure I will have you again on the podcast when you will have maybe a new feature released so that we can explain that to the audience. But yeah, I hope really the MedBoard will be the standard for all medical device companies. Okay, Ivan. So I thank you very much, and I wish you a really nice day.
Yeah, thank you, Monir. Thank you for having me. It's nice to be here. Just before I go, I just wanted to send the best wishes to everyone with this COVID crisis. It's been difficult for some people, financially, but also to be alone and stuff. So I wanted to send my best wishes, and I hope everything gets back to normal as soon as possible, and we can all enjoy meeting each other and having our close ones together.
Yeah, I agree with you. Stay safe, stay home, stay safe, and take care of you, and be on the right side. So there is the vaccine now, so we hope this will be working. But yeah, still stay safe, because we are still in a pandemic situation. Okay, Ivan. So thank you very much, and have a nice day. Bye.
Thank you so much, Monir. Thank you so much. Bye.